We believe that all children deserve the opportunity to communicate, even if they are deaf. That belief is the foundation of what drives us to achieve our mission at the Center for Hearing and Speech, to enable children with hearing impairments to reach their full potential by teaching them listening, speaking, and literacy skills. What began as a small school serving 7 children in 1947 has now grown into a multifaceted organization serving thousands of children each year. In a city as large and diverse as Houston, the center is the only full-service resource for the pediatric hearing-impaired population. Our programs are designed to identify, intervene, and educate, and they're all available under one roof. We're vital to the children we serve, working with children from as many as 27 counties and 283 zip codes each year. Deafness doesn't discriminate. It occurs in every neighborhood, every race, and every socioeconomic level. Our commitment to this community is to provide affordable, high-quality care for any child who needs help. Our main objective is to give deaf and hard of hearing children a voice. Now, how do we do that? The first step is to identify the hearing loss. Our audiology clinic can do this through a variety of diagnostic tests, including auditory brainstem response, or ABR testing, which can determine the severity and cause of the loss. Then our audiologists fit the child with hearing aids to gain access to sound. But sometimes hearing aids aren't powerful enough. For those children, cochlear implants are an option as early as 12 months of age. Access to sound is only the beginning. Now the child needs to learn how to interpret the sounds he is hearing. This is when we provide intensive speech therapy and perhaps our auditory oral school called the Melinda Webb School. Our goal is to give these children the tools they need to attend a mainstream school by 1st grade. But we don't stop there. We also know that deafness affects the entire family, and strong family involvement is crucial to the success of hearing-impaired children. So we've developed comprehensive support services to address the family's emotional needs as well. The center houses the only oral educational institution for deaf children in the greater Houston area. There are a total of 48 similar institutions worldwide, with 3 in Texas. There are several other audiological and speech therapy service providers in the Houston area, but the center is the sole provider that specializes in pediatric hearing-impaired patients and offers a sliding scale option for clients who don't have insurance or Medicaid. There's no getting around that it's very expensive to teach a child with hearing loss to listen and speak. But our work also has a great return on investment. For every deaf child who learns to listen and speak, we'll save taxpayers $400,000 in special education expenses and a total of $1 million in lifetime expenses, because he will be a fully employed, contributing member of society. We also have created innovative programs that are not only unique to Houston, but modeled around the nation, like our Parent-Infant Program, Cutting-Edge Bilingual Therapy, Hearing Loss Prevention Initiative, and our wildly successful summer camp. Our effectiveness is rooted in our ability to work cross-departmentally to address each client's health and educational needs. Using highly trained professionals and advanced technology, we're able to achieve optimum results. Another piece of the puzzle is parent involvement. We work hard to educate and support our parents so they can be the best advocates for their child. We also capitalize on collaborations to achieve our mission. At any one time, we're collaborating with at least 20 school districts in the region, as well as medical teams from area hospitals and dozens of professionals. And we're all working together to maximize our clients' success. We're proud that we can provide the highest quality of services to every child who needs them. All of our programs use evidence-based clinical guidelines with clear and measurable outcomes. For example, we use standardized assessments to demonstrate our students' mainstream readiness. And each year, the Center reviews achievements and challenges of each service area and adjusts resources and programming as necessary. Over the long term, success will be evident as the Center moves closer to achieving the organization's vision. All children with hearing impairments will be identified early, families will have access to medical and educational resources, and professionals will provide a supportive learning environment where self-reliance through oral education is achieved. Some people may not know that while our main focus is providing services to enable deaf children to listen and speak, we have several other programs and services to address their various needs. Our audiology clinic works with hearing impaired children of all ages who use all communication modes, equipping them with technology and monitoring their care. We also go out into the community to do other things. We visit low-income schools annually to screen children for hearing loss. Even a mild hearing loss that goes undetected can have negative effects on academic success. Another important thing we address is hearing loss prevention, educating children and parents on how to protect one of their most valuable assets. And in the age of iPods and video games, noise-induced hearing loss has increased dramatically. The need for this awareness program has never been greater. We focus on the best outcome for every single child. While oral communication isn't the only option parents can choose, we've demonstrated outcomes for children who've learned to listen and speak. Outcomes in literacy achievement, school readiness, and self-esteem. Our children have literacy rates on par with their hearing peers. Deaf children who don't learn to communicate orally have an average third-grade reading level. We have hundreds of success stories of our kids graduating from high school, attending college, and thriving in careers of their choice. In a much larger sense, the true impact of what we do is impossible to measure. Our success can be seen, or rather heard, in every interaction our clients have for the rest of their lives. Every time they take part in a classroom discussion, every time they visit the bank to make a financial transaction, every conversation they have with their family around the dinner table. The list can go on and on. The tools we provide early on literally transform the rest of their lives and connect them to our hearing world. One of the challenges that we face is a severe shortage of qualified professionals to serve the growing number of children in need of oral educational services. In 2007, the Texas Department of State Health Services reported that 45 Texas counties don't have a practicing speech-language pathologist, and the shortage of therapists trained in oral therapy for deaf children is far greater. Furthermore, there's only one graduate program in the state of Texas. It produces 1 to 5 graduates per year, prepared to serve the oral communication needs of all deaf children in Texas. This is especially challenging because parents are choosing spoken language for their hearing-impaired children more than ever. In fact, over 85% of parents chose spoken language for their deaf children in 2005, compared to only 40% in 1995. To keep up with demand, we have to compete with other institutions for a small pool of available resources. So we dedicate time to educate and mentor aspiring professionals and offer them a practicum site. Another ongoing challenge is that there are still people who don't know that deaf children can listen and speak. We constantly work on awareness in a variety of ways, distributing written materials, hosting workshops, presenting to grand rounds, medical clinics, nursing graduates, and other professionals, and using our website and social media to convey our messages. We've been able to accomplish so much during the past 6 decades because our community believed in us. Additional resources would help the center continue to expand programming to meet the increasing demand for services and enhancing each client's potential for success. The center receives no government funding and depends on the generosity of individuals, foundations, and corporations for approximately half of our annual budget. The remaining budget is funded by insurance reimbursement, fees for service, the United Way of Greater Houston, and our endowment. Our professionals are constantly thinking of new and innovative ways to reach and serve the pediatric population. And increased funding could bring those ideas to life. With your financial support and ample manpower, we can give these children even more opportunities for independence and lifelong success. Expanding our bilingual program and adding more educational services for older children are only 2 examples of how we could do more. Most of the center's educational services focus on school readiness, but there are still definite gaps in the public school system to provide the services children need throughout their academic careers. Services to achieve educational milestones leading to high school graduation. Tutoring programs or math and reading camps are examples of how the center could supplement what's being done in neighborhood schools.